does one prevent infertility? I think there are a number of ways that one can try to prevent infertility to a certain extent. We are all well aware there are a number of lifestyle factors that can affect both male fertility and female fertility, and these include smoking, alcohol consumption, caffeine consumption, diet, body mass index or BMI, stress management. So some of these are the factors that one needs to consider when you're trying to conceive or just starting or preparing for a fertility treatment. Smoking is well known to affect both male fertility and female fertility. In men, smoking leads to low sperm count, low motility, low morphology, and probably affects the viability of the sperms. In women, smoking can lead to reduction in the ovarian reserves and affect the quality of the eggs. So therefore, it is important that if you are smoking, you at least quit smoking at least 3 to 6 months prior to starting the treatment, or if you want to prevent infertility before you start trying to conceive. Heavy alcohol consumption as well as binge drinking can affect both male fertility and female fertility. It can also affect the development of the fetus if you are pregnant. Therefore, NICE, National Institute of Clinical Excellence, recommends to restrict alcohol intake to 1 to 2 units for women and 3 to 5 units for men. However, many international specialist societies and the current thinking is more steering towards total abstinence of alcohol when you're trying to conceive or when you're preparing for your fertility treatment, including during the pregnancy if the treatment were to be successful. Besides smoking and alcohol, excess caffeine consumption is an important factor affecting both male fertility and female infertility. In addition, it can also lead to an increased risk of miscarriages. So therefore, it is important to consume caffeine in moderation or potentially total abstinence. Maintaining a healthy balanced diet with an adequate daily intake of the macronutrients, micronutrients, trace elements and minerals is important. For men, it is also important to have good intake of natural antioxidants and have elements such as zinc, selenium, lycopene, vitamin C, vitamin E. These are some of the common dietary components that are very important not only for men but even for women to a certain extent. Maintaining healthy BMI is important. For women, we do know that body mass index or BMI of more than 435 can affect ovulation as well as it can affect the implantation of the embryo. So therefore, if you suffer from polycystic ovarian syndrome or you've been diagnosed with PCOS and you do have a higher BMI, even a 5% loss of weight can correct your menstrual cycle and restore your fertility. This will help avoid you going through more complex fertility treatments. The other important thing is looking at the stress. Stress can affect both male and female fertility. We don't have a direct association or link, but there are certainly studies that are suggesting it takes longer for couples to conceive. So managing stress in different ways is a very important part of the strategy if you're trying to conceive. As regards men, they should certainly avoid exposure to hot temperatures such as hot baths or tight clothing. So by using some of these ways, one can prevent infertility, as well as if you're preparing for your fertility treatment, then you should take these into consideration.